Okay, so I think everyone is connected. So again, welcome everyone to this webinar. It's the last one for the year. We will be talking about stenting. So we'll be talking about the tools that GE is providing to provide you as much information as possible when you're doing when you're placing stents. So it will be about preparing how to and where to place the stent, correcting if you realize that you're about to place the stent in the wrong position, and then assessing once you have deployed your stent to assess the results and to see if it needs some optimization. I'm showing my disclaimers here, and then I will just quickly go through the agenda of the webinar. So the two main tools are StentViz and StentVesselViz, and these are the tools that can assist you in the preparation and the assessment of the stent deployment. So what we will cover now is the workflows, so how to perform a StentViz and how to perform a StentVesselViz acquisition, and then we will see what the clinical benefits of these tools are. And I thought that the best way to do that is not by me saying it, but by watching a compilation, let's say a version of the video of a procedure that Dr. Benamel, which is an interventional cardiologist in Massy in France, is doing. So we'll see a case where he's placing stents and he's using and he's alternating between the two tools. And you will see what is the benefit of each tool depending on the situation. So quickly, we will talk about what StentViz does. First of all, as you can see here in the picture, it's a static image. It is the image of the stent that has been deployed. And you can see also here that the image is split in half. And on the left side, you see the stent with a guide wire that is between the markers of the balloon. And on the right side, you have again the stent, but the guide wire that is between the two markers has been subtracted. So that is the difference between the two images. So basically, it's the same, it's just that on the right, you don't see the guide wire, and it actually helps a bit to visualize the stent better. So StentViz will help you assess the correct deployment of a stent. So once you've opened it, then you do a StentViz acquisition and you see if it's been properly deployed or not. The other way to leverage this tool is to use it to position a stent with respect to another one. So before you deploy the stent, if you already have a stent that is deployed in the image and you want to position another one and you want to make sure that there's the right amount of overlap, then in this case you can do a StentViz acquisition and you will see the deployed stent and the non-deployed stent, and clearly with detail you will understand what the relationship between the two stents is. So, for example, here just a little example about using StentViz to assess the deployment. See, the first image is you see the stent that is shown by StentViz, and you can see that where the red arrow is, you can understand that it hasn't been properly deployed. So there's a bit of a part of the stent that is not completely open. Then, in this case, you would do a proximal optimization technique. So basically, you would reinflate the non-compliant balloon and make the stent open even more. And then you would do a StentViz again, and now you can see where the red arrow is, you see that the stent is fully open. So that would be, for example, a way to use the StentViz tool. The other way to use it is, as we said, to plan. So, for example, you have a pre-existing stent, as you can see here, and you want to place the new one, which is not deployed yet. And in this case, you do a StentViz. You see the pre-existing stent, and you see the other one, the one that you're about to place, and you see the relationship between them. So in this case, for example, you have a bifurcation, so one stent is coming out of the other one. So now about the workflow. So how would you perform it? It's simple steps. The one thing to remember though is that you need to have, once you've opened your stent and you want to assess, for example, what it looks like, you shouldn't forget to leave the balloon and the guide wire inside the stent, because the software is based on the markers of the balloon. So you leave it in there. You center your image on the stent. So collimating and zooming will improve the outcome. We always tell people that the better preparation you do, the more sure you are about the result of your StentViz acquisition. So if you center, if you collimate, if you zoom, make sure that the stent is right in the center of the image. It's properly seen, and you don't have maybe something else overlapping, like a cable or something that is on top of it. Then you're going to have a good result in the StentViz acquisition. Then you select StentViz. A system you can either do it from the control room or from the touchscreen that is in the procedure room. And then you will see a message on the live monitor that says ready for StentViz. You will press the record pedal. So it's the same radiation that a normal record acquisition, nothing extra about it. So it's a record acquisition. You wouldn't do any injection, of course, in this case. You only want to visualize the stent. When enough frames have been acquired, in this case is 30, the software needs 30 frames, you will see a message on the monitor that says stop X-ray. Then all you have to do is release the pedal, and the StentViz image will be on the reference monitor and will be also saved on your system. So that is it. It's a simple workflow. It's basically the press of a button, press of a pedal, and the image is produced. I'm going to talk about StentVesselViz now. So that's the little brother of StentViz. It is a fade-in, fade-out sequence. So what you have here is a static image, because it was simpler for me to just put the image, but I will show you exactly the sequence, how it looks when you have a StentVesselViz acquisition. So it's a sequence of an injected sequence and a StentViz image overlaid, let's say, in a fade-in, fade-out mode. So with the same sequence, you're able to see the vessels, because they are injected, and the stent, as if you were just looking at the stent alone in a StentViz image. What StentVesselViz does is that it helps assess the correct deployment of the stent in relation with the vessel. So that's the difference with StentViz. Because you can see the vessels, then you completely understand the anatomy of the vessel, and so the position of the stent compared to the anatomy of the vessel then is possible. So I will just show you here quickly the presentation of a StentVesselViz acquisition. So here is the video. This is on a AW workstation. So you can see here we're going from a DSA to a image of the StentViz. So you can see, and we're going through a fade in, fade out mode. So in the end, you get to see both. That's it. And then I will also show you now another video because it will show you more what it means when you want to assess the position of the stent compared to the anatomy of the vessels. So let me show you again. So as we can see here, we have a bifurcation, and we can see that we've placed the balloon, but it is too proximal, and it is not covering the corona. So once you've done the StentVesselViz and you realize that, then you will push the balloon more distally, and then you will do the StentVesselViz again. And you can see here that in this case, it's in the right position because it is covering the corona. So that would be in the case of a pop, for example. Showing it again. There. So you can see that we've pushed the balloon to cover what we need. Okay, so I will stop sharing here. I want to talk to you now about the StentVesselViz workflow. Again, it's pretty simple. It's similar to the StentViz workflow. So you need to do the same exact thing. You keep the guide wire and the balloon inside the stent. It's based on that again to create first the StentViz image and then the StentVesselViz sequence. Then center, collimate, and zoom to get the best outcome. Press on the StentVesselViz button that is on the touchscreen in the room or on the DL in the control room. You'll see ready for StentVesselViz on the live monitor. Press on the record pedal. And you will see the message inject on the live monitor. This is an injected acquisition. You will inject the contrast and then you'll release the pedal at the end of the injection, and the StentVesselViz sequence will play on the live monitor and will be saved. There is an extra tool, which is the Stent Refine tool, and it is done in the case of a failed acquisition, whether you have a StentViz or a StentVesselViz. That didn't work out very well because, for example, you hadn't centered very well or you hadn't zoomed enough, so the result is not satisfying. In this case, you don't have to redo the acquisition, so meaning you don't have to press the pedal again and you don't have to inject contrast if we're talking about StentVesselViz. You can just select the StentViz or the StentVesselViz sequence. You launch the review. Then you do a minor post-processing yourself, so you zoom the image and then you center on the stent. And then you have a button that says Stent Refine, again, either on the touchscreen or on the DL, and that's it. And it will launch again the workflow, and it will give you a new image. Now I think is the most important part, and is when I want to show you Dr. Bellamer's case. The video has been edited, of course, so I'm showing little parts because we can't see the whole case, it's too long. So what I have done is that I have edited it. I'm showing some key moments during the procedure, and I'll be talking and explaining every step of the way. So I will share my screen again now. Okay. So here we go. As I said, it's Dr. Benamé. He's an interventional cardiologist in France. So we will first of all present the case. The case is a left main bifurcation T-stenting. So the patient is a male of 72 years old who already had some cardiac history. So a few years ago, they had seen that the LAD circumflex and right coronary artery had to be stented, and they used a drug-eluting stent. And then he now had an angiography, and it showed stenosis of left main, LAD, and circumflex. So what are the challenges when dealing with stenting areas like that, which we're talking about bifurcations basically? Well, the precise position of the stent at the ostium. So the one vessel begins and comes out of the main one. The precise opening of the stent to minimize the stent overlap, but also make sure that there's not a big gap between the two stents. So you want that tight balance between the two. So let's see now the first step, that will be to stent the left main. So he will position the non-inflated balloon on the underploid stent, yet underploid, in the left main. And he will do a StentVesselViz to see the stent position compared to the ostium. So he still hasn't deployed anything. He will do the StentVesselViz. This is the sequence 1. So you can see the 3 arteries that have the names on the image for you. So you see that the stent is partially in. So we inflate the balloon and the stent is being deployed. One important thing that Dr. Benamé is mentioning is that the left main stent's diameter is the diameter of the LAD, right? Because it's always the diameter of the smaller vessel. In this case, the stent, when you first put it in, it is not properly impacted on the walls of the left main, which is the bigger vessel. So what he has to do is the proximal optimization technique. So he has to put in the non-compliant balloon and inflate it so that he knows that he'll push the stent against the walls of the big vessel. So he's putting the non-compliant balloon. Then he will do a StentVesselViz before inflating this balloon. And that's the point, like the example we saw before, that he wants to make sure that the corona, right at the point of the ostium, will be covered by the balloon. So you can see here the balloon has been placed too proximal. It's not far enough away distally, so it's not covering the carina. So Dr. Benamé realizes that, so he'll push the balloon more distally and repeat the StentVesselViz. And there he can see that the balloon is in the right position. So now with confidence, he can perform the proximal optimization technique. Then he'll do a StentViz to check if the left main stent is fully open. So now you care about the stent itself, but he can see here that the ostium, it's not fully open. So he pull the balloon back and perform on the ostium. And then he'll do StentViz to check what is done. So now it's fully open and he's happy with the result. So the part of the left main leading to LAD now has been dealt with. So he's happy with the result. Next step will be to put the stent that covers the circumflex. So he will open the strut of the left main stent, the strut that goes towards the circumflex with a balloon, and then he'll position the circumflex balloon and stent through that. So still, balloon is not inflated. He will do a StentViz to check the circumflex stent position. So it hasn't inflated the balloon, but he wants to check the position of the stent compared to the left main stent. So you can see here, you have the left main, the LAD, and the circumflex. And in the circumflex, he has the underplate stent and balloon. And in the left main going to the LAD, we can see the stent that's already existing. And he did the StentViz acquisition because he wants to check the relationship between the two stents. So he will then do a StentVesselViz to check the stent position now compared to the vessel. Before, he did a StentViz to check the new stent compared to the old stent, and now he'll do the StentVesselViz to check the new stent compared to the vessel. So there. Compared to the vessel, you see a new stent. He will put the balloon now in the LAD and he'll do the kissing balloon technique. And the circumflex stent is deployed, and we'll do now a StentViz to check that the stent has been properly deployed. And the one in the circumflex. He will do again a port on the left main, and then he'll do StentViz to check that the circumflex stent part that is in the left main. And at the end, he will do the spider view to just check the final results and what it looks like. Yeah, and it's a very nice result. And that's it. So I want to thank you all very much for attending this webinar. Please don't hesitate to contact me if there are any questions from your side. My contact details are here.